On behalf of the G20 Health and Development Partnership, it is indeed my great pleasure and privilege to welcome you all to the annual H20 Summit.
The challenge now, of course, is for the G20, the G7, the World Health Organization, the Commonwealth and other multilateral institutions to consolidate the new public-private partnerships that have been created out of the global pandemic, and then build upon these foundations to ensure we have a global health architecture that is equitable and which is able to respond effectively and deploy sufficient resources in a systematic way to address the growing risk from new pathogens, antimicrobial resistance, sepsis, NCDs, while of course maintaining the essential fight against tuberculosis, malaria, HIV and AIDS, and NTDs.
In terms of health financing, this is one of our key mantras that we are pushing since 2018. How we can bring together health and finance ministers and make the case that health is a positive investment into the well-being of our societies and economies.
This COVID-19 is a wake-up call for everybody in the world that we have to be prepared if that's something happening. We don't expect that one, but when it is happening, we have to be prepared.
For the last 5 years, the G20 Health and Development Partnerships H20 Summit has brought together global health thought leaders and stakeholders from around the world and across health and finance and other sectors. The H20 support and advocacy for demonstrating the link between the health of populations and economies is helping to influence the narrative in G20 and G7 discussions. Rather than referring to health as a cost, it's now often seen as an investment. Of course, we have to do more. I'm grateful to the H20 for its important role in raising awareness, particularly in finance ministers, that there is a significant return on strategic investments in health, research, and improving access.
The setting up of the Financial Intermediary Fund, a bit of a technical name, I think we need a simpler name for this, in a year where we've had many problems in the world, is a real achievement. And I really want to credit Indonesia's leadership, building on Italy's leadership, for having made this possible. It is a good start. It is not victory. It is a good start. Setting up a new pandemic preparedness fund, mobilizing more than $1 billion already from about 15 countries, both developed and developing. It's a good start, but we now have to go much further.
I think I said during the 2019 and 2020, we were all in the same storm, but we definitely were not in the same boat. And so one of the big issues for us was how that equity should be delivered. And through the Commonwealth Health Ministers meeting, which took place immediately the next year in 2020, we brought together all our health ministers to share what worked and what didn't work, and we created technical implementation groups. But there's so much from the conversation we've had this morning that really is echoing in what we are doing and how we see it, but inequity is a real issue for us.
Those 5 principles are: 1, universal access and inclusive governance to ensure that the fifth actually has legitimacy in all countries, and especially in the global south. 2nd, sustainable multi-year financing that doesn't leave it kind of hand to mouth and constantly focus on replenishing that fund from the start. 3rd, sufficient resources to address a multi-billion-dollar annual gap. 4th, and incredibly important, transparency in the decision-making and evaluation metrics. and finally, complementarity and additionality to actually make sure that we're not kind of gaming the system and using this fifth to actually cannibalize on other types of funds. Right? So this needs to be additional and complementary, not actually replacing something else. And, you know, the unfortunate situation is that on the verge of the fifth's finalization later this month, we remain deeply concerned on actually all of these fronts about how the fifth is shaping up.
The inter-pandemic period is shrinking between viruses. It used to be decades. When I started my career and I trained in public health, I thought, gosh, it would be interesting to see a pandemic. And now I'm thinking the last thing I want to see is another pandemic. I've lived through 5 of them, and the period between them is getting shorter and the amount of sleep is getting less. So these are a reality of our world. They're a reality, as Rachel, others have spoken to this morning, of the risk to global economic health, global health, as well as really societal stability. So important we get this right. The constructive inputs of groups like this to instruments like the fifth will be crucial.
In fact, in reality, there have been a lot of youth all around the world that have really taken up the initiative to, when they identify certain problems within their communities, to actually start doing something to solve issues within their communities, right? So, for example, here at the Global Youth Mobilization, we have funded more than 300 projects that are targeted towards solving some of the health and societal issues that are exacerbated by the COVID-19 pandemic.
Often, ministries of health have a challenge of, completely spending down all the money, and spending it in time, or that they go over budget because they're still dealing with arrears based off of the delays before. So how do we create a marriage between ministries of finance and ministries of health that allows for this kind of adaptability, allows for this kind of, stable funding flows in terms of timeliness, but also, the amount that's coming, and therefore you can plan more effectively for your needs, for your priorities, and this eventually now gets to more effective health outcomes.